Hello, my name is Meghan Ward. I'm a neurologist at the Hartford Healthcare Eye and Neuroscience Institute. I specialize in epilepsy. So when I was a medical student, my first rotation was neurology, and I really enjoyed it. The most inspiring cases I saw were actually patients with epilepsy, although at the time I didn't know I wanted to go into epilepsy, but it did turn out that way. As an epileptologist, my training was focused on treating refractory seizures, so those that need medical devices or surgeries or alternative methods of medicine to help control their seizures. But I really am interested in all parts of epilepsy, so I am interested in psychogenic non-epileptic seizures and actually find working with those patients very satisfying. I think that patients should feel really a part of their care, and they should feel like they have some agency in their care, because often people with seizures and non-epileptic seizures just feel like they've lost a lot of control, which can really affect their quality of life. So I really try to be transparent in why I would like to do what I would like to do, and also offer all the options available to my patients so that they can make an informed decision and feel like they have some semblance of control. I feel one of the most interesting developments in epilepsy recently is responsive neurostimulation. It's a device that sits on the surface of the brain, actually sits in the skull, and there are electrodes that go either into the brain or to the surface of the brain, and they constantly record the brain's activity. And then once it does detect a seizure, we're able to control how it stimulates the brain to help stop those seizures in real time. One of the reasons why I came to Hartford Healthcare is because of the team that Dr. Martz has been able to build here. And there's a great support system for the patients and also for the providers who work here, so that we're able to provide the highest quality of care to our patients. Referring providers and patients should know that I take as much time as I need to with each of my patients to come up with the appropriate diagnosis and plan of care. And I am happy to co-manage patients with their referring providers so that we can get them appropriate care as quickly as possible. And I will also take as much time as I need to with each of my patients once they do see me in clinic. Outside of medicine, I live with my husband and my dog. We like to stay active, whether it's outdoors, rowing, kayaking, downhill skiing, or indoors with our Peloton and our weights.